panelist list. I will now turn the presentation over to Kyle Fowler, Vice President of COVID-19 Project Management at Thermo Fisher Scientific. Kyle, it's all yours.
Thank you, Ian. Good morning, everyone, and welcome to the third in a series of webinars designed to educate HR, EH&S, risk management, and other COVID-19 response task force members on various dimensions of testing and returning safely to the workplace or academic setting. My name is Kyle Fowler, and I'll be your host for today's session, which we've titled "Is COVID-19 Screening the Right Testing Strategy for My Workplace?" Next slide, please. Before I introduce our speakers for today, I'd like to introduce Thermo Fisher Scientific. Next, please. Thermo Fisher is the world leader in serving science, employing more than 75,000 colleagues globally, more than 5,000 of whom are scientists. Thermo Fisher is also the leading single-source supplier for COVID-19 testing needs, with involvement in more than 50% of worldwide testing. We have the instruments, test kits, and reagents the world needs now, and we've accelerated our manufacturing and development pipelines to provide additional solutions to meet the evolving needs of tomorrow. We are the trusted partner our customers need, helping them respond to unprecedented testing demands and provide accurate, proven results. Next slide, please. Our response to COVID-19 is a powerful example of our mission, namely that we enable our customers to make the world healthier, cleaner, and safer. In this educational webinar series, we share our scientific knowledge and COVID-19 responses in hopes of enabling you and your organization to scale your workforces safely and restart the economy. By no means have we discovered the perfect solution for every situation, but we hope that by sharing our story, we can help you make your community healthier, cleaner, and safer. Next slide, please. So the topic for today's discussion is COVID-19 epidemiology and workplace testing strategies. Joining me today are speakers Dr. Alan Sachs, Chief Scientific Officer at Thermo Fisher Scientific, and Dr. Judd Walton, Professor of Global Health, Medicine, Pediatrics, and Epidemiology at the University of Washington. Alan leads innovation here at Thermo Fisher, including efforts to help customers accelerate life sciences research, solve complex analytical challenges, and improve patient diagnostics. He holds a BA in biochemistry from Cornell University, an MD from Stanford Medical School, and a PhD in cell biology. Alan, thank you for joining us today and for sharing your thoughts. Judd is an expert in global health and in epidemiology. He has extensive experience in observational and clinical trials around the world, and he is an expert in the area of infectious diseases. Judd obtained his MD and MPH from Tufts University. We're honored to have Judd help us understand epidemiological tools and strategies that we can use to help make our workplaces safer. And with that, I'll turn it over to you, Alan and Judd.
Thank you, Kyle. And Judd, thank you for helping here. Let's go to the next slide, please. Judd, thinking about, COVID-19 in the United States and around the world, I know that you as an epidemiologist think population level. So why don't we just start with a description of how you see the United States' population of COVID-19 incidents and how you think about movement across the country.
Sure. As I'm sure everyone on this call is aware, many people in the United States have been and continue to be infected by COVID-19. Estimates currently suggest that over 7 million cases of confirmed COVID-19 have occurred. But I think what's really important to recognize is the diversity of those infections as they're distributed across the United States. If you look at that map on the lower right, you really get an appreciation of the fact that the distribution of these cases is not uniform throughout our country. And this has a lot of implications. It has implications for how we view our own risk and how we have seen this pandemic evolve in our own communities and our own neighborhoods, but it also has really important implications for how we address this within our own communities, our workplaces, and our homes.
Judd, as an employer, is it relevant to understand the prevalence of the disease in your locality?
Yeah, I think it really is. Prevalence referring to the number of cases of disease in a population at a given time is a really important tool that we use, a metric that we use as epidemiologists. It's a snapshot in time of what's going on. And obviously, if we are in an area where the prevalence or the number of cases right now is very low, that gives us a sense of where we are, but it also allows us to think forward about where we might go from here. And likewise, if we're in an area where the prevalence is very high, that gives us a very different sense of where we're starting and where we need to go in the future. So understanding that baseline prevalence we'll talk about is a really key component to understanding strategies to avoid infection moving forward.
Great. Let's go to the next slide, because one of the, you think globally population level, an employer thinks about their workplace, particularly a large workplace. Is it fair to think of this as a population, and how would you describe protecting it from COVID-19?
Sure. When we talk about populations, we can talk about a population as big as the world, or we can talk about smaller populations from regions to countries to cities to communities and ultimately even to households. And so a population really is an artificial term that we use to describe a group of individuals in any way that is meaningful for the conversation. For today, we may be talking about a workplace as a population, and we can imagine that workplace as a bubble. And inside that bubble, we have individuals who make up our workforce. But it's really important to recognize that in many populations, the population has people going in and out, as you can see by those arrows circling around the borders of our bubble. And so the population is important because it represents not only those stable individuals who remain inside the bubble, but also the activity that's happening that's altering the population in and out of the bubble. And so if we think about the workforce, it's important that we start with what's our bubble and how do we keep the people in that bubble safe and healthy as we move forward.
So really, right now, although this topic today is on testing, we're thinking of the bubble as a physical protection with physical things, the virus moving in and out. Let's go to the next slide. Maybe you can, before we go deeper into testing, describe some of the ways to protect the bubble that are more physical.
Yeah, I think it's really, really critical, as all of us have been hearing repeatedly in the news, to recognize the importance of the many, many tools we have in our toolkit to prevent infection. And not any one of these tools can build the entire house of a safe bubble. Just like in all projects, we need a variety of tools. They all have a role. We've all heard about the role of social distancing, masks, making sure that we have good hygiene and cleaning our hands frequently. Those are really, really critical components of our toolkit, and they remain critical components of the toolkit, regardless of whether we introduce additional strategies such as testing. However, there are other tools as well. In the workplace, there are specific tools, such as thinking about how we create assigned zones within the workplace to isolate groups of individuals from each other, or reducing the number of on-site staff in particular areas so that social distancing is easier to maintain and cleanliness is easier to maintain. So these are all really important tools. And testing is another tool, and it has a role that can be very powerful if employed in combination with these other tools in the toolkit.
Good. So that really does put into perspective that an employer really needs to practice many different approaches to protecting their environment, including testing. And let's go to the next slide, because now we have a situation in this bubble that we have someone who's infected, as highlighted in red. That seems pretty straightforward. Someone comes in, they have a fever, we get them tested. What about those other two circles where the person doesn't seem to be infected?
Yeah, thanks. There's a couple of really important points to make on this slide. The first is that when people are infected, they remain infectious for a period of time. And so it's important that the earlier we can figure out who's infected and remove them from our bubble, the less likelihood there is that they're going to transmit that infection to others. And so a key aspect of this strategy is early identification of people who may be infected with coronavirus. Now, as you mentioned, some people will come in and have fever or cough or other symptoms that we can readily identify as possibly being due to COVID-19. And we can act on that. We can prevent them from coming into the workplace. We can ask them to go home, et cetera. However, it's really, really important to note that about half of all people with COVID-19 actually never have any symptoms, and yet they remain infectious. So relying just on symptom screening risks the fact that many people in the workplace could still be infected and we wouldn't necessarily know it.
Yeah, it is quite scary. And, as the data continue to be released, it would seem that the amount of virus in these asymptomatic individuals isn't that different from the amount of virus in someone showing symptoms, which I believe makes them as infectious. Would you agree with that?
Yeah, it's very interesting. If we look at individuals, we can find some individuals who are shedding higher amounts of virus than other individuals. And there are things that are associated with that. And one of them is being very sick with COVID may make you more infectious in that sense. At the individual level, we certainly can find people who seem to be shedding more virus. However, at the population level, when we look at averages across large numbers of people, that is a very unreliable indicator of infectiousness. So banking on the fact that somebody has symptoms to tell us how infectious they are is a real gamble and not likely to be very accurate when we talk about groups of individuals.
Okay, well, let's go to the next slide and do a deeper dive on sort of the life cycle of this virus and when people come to work knowing they are or are not sick.
Yeah, so if you start on the left side of this figure and you see the individual standing there uninfected with the virus, this is what we all hope to be and what we all hope to have in our workplace, individuals who have not acquired the virus. But as we move to the right, you can see this individual now has acquired an infection with COVID-19. This could have happened in the workplace, it could have happened in the home, it could have happened many places. Now, when they become infected, there's about a 4 to 5 day period while that virus is replicating before even those people who become symptomatic will display symptoms. So those people who've recently been infected can go one of two ways. We've talked about the fact that about half of them, about 45%, will never, ever develop symptoms. We call those asymptomatic individuals who remain asymptomatic throughout the course of their disease. Another group of people, the other half, will become symptomatic eventually. But importantly, there'll be a period of, on average, 4 to 5 days between the time they got infected and the virus is circulating in them and the time that they display any symptoms. And it's that window that we worry about where they're transmitting virus without any symptoms. And then after that 4 to 5 days, there's about a 10-day period where people, regardless of if they have those symptoms, there's an additional 10 days where they remain where they remain infectious. So the key message here is there's a very long duration of time, about 2 weeks, during which time people are shedding virus and have the potential to infect others. And the earlier we can identify who those people are who've acquired the virus and remove them from our population and get them the care that they need to stay safe and well, but also protect the other people in our workforce or our families, the better off we're going to be.
So really the practicing of good hygiene, distancing, wearing a mask all help prevent these people from infecting others, even though they don't know they're carrying the virus. But testing is an additional tool that really further improves the probability of finding them and protects them.
That's right. That's exactly right. It's like the combination of seatbelts and airbags. They're both really important. They both play a role in preventing deaths. And that's exactly what we're talking about here. Masks, social distancing are critical components, but testing can also play an important role here.
Well, let's go to the next slide because this timeline sort of suggests that if you just test once, you're not done, because if you test them on the wrong day, you'll miss the chance to identify them. Do you agree? And how do you think about that?
Well, that's absolutely right. People can be uninfected today and you test them and they're negative and then tomorrow they got infected. And so the question is, how frequently do we test people? And obviously this is a delicate balance. We want to be able to test people as often as needed to be able to detect as many as we can as early as possible. On the other hand, there are practical realities in terms of the logistics of testing, the willingness of people to be repeatedly tested, and obviously cost and other considerations. So it's really about coming to a balance, given your population and what that baseline rate of infection is that we talked about. What's the ideal frequency for you to have confidence that you're likely to be picking up those early transmission events as soon as you can?
Now, I know that's not just your opinion. If we go to the next slide, it's also the guidance that we're hearing from our Center for Disease Control. Maybe you can review that for our guests.
Yeah, I think that it's very important to recognize that there are workplace guidance documents that have been made available at the global level and certainly at our own national level as well as at the state and regional level. And these documents can be really informative. And I think, as I've reiterated multiple times today, they stress the importance of all of these tools in preventing transmission in the workplace and really the importance of social distancing, mask wearing, et cetera. But they also recognize that in many settings, testing may be an important component of early detection and prevention of transmission. And particularly, they reinforce this fact that asymptomatic individuals may be spreading disease, and if in the absence of testing, we may not be able to identify them. So in certain situations, some of which are summarized here on the slide, testing may be a very, very valuable tool, as we've discussed.
And there's no question it is, but if I'm listening as an employer, what I'm hearing is test, 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 which means also spend, spend, spend. There must be ways to reduce the testing burden to an employer, but still guarantee some additional safety for the employees. Maybe on the next slide, you can go through some of these ideas.
Absolutely. And I think it's really important to recognize that this all has to be grounded in the practical realities that people face. But that doesn't mean that testing can't play an important role. Workplace baseline testing, understanding where you're starting is really important. If you're starting out at a really high level of infection, you may wish to approach your workplace in a really different way as compared to a situation where you're starting with none or very, very low numbers of infection. We may choose to test people on some routine basis, and that could be on a weekly basis, a monthly basis, on a sporadic basis. There's a variety of ways to do that. Certainly, there are people who may be entering our bubble from the outside that we don't know their status. And if we already have done everything we can to protect our bubble, we may want to consider testing people like contractors or new hires who are entering the bubble with really an unknown status. Finally, there are ways to consider randomly testing people or spot checking people within the workforce. And a strategy can be developed that allows you not to have to test everybody, but to test randomly within the population and using statistical models to infer what the actual number of infections is likely to be. And these are very robust methods that we use for lots of different purposes and can be applied here. Finally, obviously, if you do have an event where somebody does contract COVID-19, using that event as an opportunity to contact trace the people who've been on site with that person, who've been in close contact, allows you the opportunity to rapidly limit the spread of infection.
Now, I can imagine that if you are not in the world of practicing medicine and diagnostics, this is a rather complicated slide because ultimately the decision sits with the employer on what method to use for testing. And so I want to encourage the listeners at the end of this webinar, there is a place to ask questions and get input to help you choose the best testing scenario. I also want to note that we are partnered with a company called Everlywell, EVERLYWELL. You can see them at everlywell.com, which can provide 24 to 48-hour testing turnaround for employers that haven't made a commitment to do more routine testing at their site. This is a really important slide, Judd. Are there any other concepts that you want to cover before we move forward?
No, I think exactly as you said. I think it's about developing a workforce strategy that fits the needs of your workforce. And that really starts, in my mind, at making sure that those other tools are being employed to the maximum effect they can be, and then establishing a baseline to understand where you're starting from.
Great. And as we showed in the map of the United States, that baseline decision will be determined by the local incidence of disease. If no one is sick in the town, which we all hope is true someday, it's not as important to test as if you're in the middle of a crisis zone. So, well, Thermo Fisher, if we go to the next slide, we've got, taken up the practice of testing at many of our sites. And I'd like to review with you what we've done and then get some input on some of the data we found. Our corporate headquarters is in Waltham, Massachusetts, which is just outside of Boston. And we have done a number of these different testing scenarios. We've done the baseline testing for all employees who are returning to work. even if the number of people at work is reduced from the normal capacity, given the other the topics of reducing in density, et cetera. We also are performing spot checks on our employees to see if our baseline measures are changing, just to get a sense of whether the incidence in our building is significantly different than that in the population. On-demand testing for some of our staff who are traveling or returning from travel, that concept of physically protecting entry of the virus for someone who could have been exposed outside. And of course, incident management. If someone in the building has presented with symptoms or has been detected through testing to be asymptomatic, we do contact tracing and look beyond that individual. So these are all some of the examples that an employer can consider. Now, the data are really interesting, Judd. If we go to the next slide, at our Waltham site, you can see that when we did baseline testing, we only identified 0.3% of our staff to have an infection, as measured by a quantitative PCR. What are your thoughts about these data in terms of the usefulness of the baseline testing?
Well, I think there's a couple of really important messages here. One is that what's more striking to me than the percent that's positive is to flip that around and think about it as the percent that were negative. 99.7% of your population tested negative. And that 99.7% of the population probably was quite relieved to find that out. And I think that gives them a degree of confidence that if they go back into the workforce, they take those necessary steps to keep themselves safe and their work colleagues safe, that they can go back, be comfortable, and be confident that their workplaces, is ensuring as best possible that they're in a safe environment. So I think that 99.7% is a really important number.
And we'll touch on that topic in the next slide. But before I go there, we have heard from some employers that they don't have a problem. Their employees aren't sick. They're not, when they do baseline testing, they're not seeing an incidence any higher than this. They don't need to continue testing. I understand why they would say that because of the cost and the time. How do you feel about that? If you see a baseline like this, you just basically abandon testing and continue all the other practices.
Yeah, again, I think it's really important to recognize that things change over time. And we've seen that over, the last 6 months in our country, in our own cities and in our own communities. Some of us have gone from, very, very few infections, even no infections for a period of time, and then all of a sudden a spike. Other places like New York City went from very, very severe massive numbers of cases and then was able to bring that down. And of course, now the Northeast, we're seeing a slight uptick, again, a concerning uptick. So the idea that any particular spot check number or any particular cross-sectional point in time number tells us exactly not only where we are, but where we're going, I think can be misleading. So I think it's really important that we understand that we have to keep the temperature of our environment over time by testing to understand what the dynamics of the infection are in our workplace over that same period of time.
That's really good insight. Thank you. If we go to the next slide, we'll see some of the additional benefits of testing. I think you did mention this. Employees feel more confident. When we asked our employees about their response to our testing program, over 86% say they were very satisfied. Is that a surprising number to you? And how do you see this as a benefit of testing?
Yeah, I think we all are struggling with the uncertainty and the fear, frankly, about this infectious disease. This is a really unique time. And I think measures that we can take to help people feel more secure, more safe in their environments are really, really important, not only for the physical well-being, but also the mental well-being of people around us. I also think it's very true that when people feel as though they have been tested and are confirmed to be negative, and the people around them are being protected, they're actually more likely to engage in measures to keep that status. So people want to stay safe, and I think the things we can do to help people maintain safety and not only feel safe, but also ensure that they understand that those measures are working and that they can protect themselves, I think are really important public health measures in general.
I would imagine that even something as simple as the point testing you referred to earlier, where only a subset of the workplaces being tested routinely would add to the employees' confidence.
Sure, and the idea of being able to randomly select individuals for testing is not a new concept with COVID-19. We use that in many diseases. And the key there is that there are really robust methods to help figure out how to actually perform that in a way that gives us really good insight and really solid results. And so the key there is to work with colleagues like the ones that you suggested or others to figure out that strategy. But absolutely, that type of strategy can be very appropriate.
Great. Well, thank you, Judd. We all appreciate you taking the time to help us understand more deeply how an epidemiologist sees this problem from the perspective of a workplace. If we can go to the second to last slide, I just want to summarize what we've discussed. The values to testing programs at an organization are both intrinsic and extrinsic. Number one, by far, is employee safety. Keeping this bubble clean, identifying people within it by testing to help them know that they're infected and follow up is critical to maintaining a safe work environment. Obviously, by doing so, we ensure business continuity. When we look at the cost of testing of any kind relative to the cost of not doing business, the numbers don't seem quite so high. And so business continuity really is a very positive outcome of a good testing program. And as we discussed, employee confidence, confidence in their company, confidence that their coworkers are also not infected, that they're all willing to practice all these other measures because they know the company is paying attention. That all is another benefit. And then our standing in the community, a community that knows a business is practicing this type of hygiene is going to be well regarded in the community, and it's an opportunity for employers to discuss their company's processes in the local community to be more visible. So we see a lot of values in testing, and I hope that the listeners have learned today what some of those values are. If we can go to the last slide, I'm going to turn it back to Kyle now, who will be happy to take questions, and those questions will be answered by any number of us on the call. Thank you again, Judd.
Thank you.
Alan and Judd, thank you today. That was some great information, and we do definitely appreciate it. We've got a couple questions keyed up already. Before we do that, I'm going to introduce Carlin Billings from Everlywell. She's Executive Director for Business Development and may be able to help answer some questions. So maybe we'll just jump right into it. The first one is, I think probably best directed at you, Judd, and it's when is it appropriate to test vendors who will be in your building for a short time, such as 5 minutes to pick up laundry or 3 hours to fix a machine?
Yeah, thanks for the question. So first of all, I think it's really important to go back to, those pillars of protection, all those tools that we have in the toolkit. And the first thing I would say is, in all of these situations, the goal should first be to reduce the amount of contact between outside individuals in any way possible. For many workforces, that has meant moving completely remotely and not interacting with vendors and others. Where that's possible, obviously, that's the greatest degree of protection. Where that's not possible and testing needs to happen, then you need to start thinking about how to protect your workers with those other tools, including masks, social distancing, but also what's the appropriate frequency of testing. Obviously, the ideal would be to test any individual who's coming into contact with a new group of individuals who you do not know their recent status. And particularly if you're unclear about how well they have adhered to some of those other safety protocols. The challenge, of course, is that you may not know the result of that test immediately. And so it's a balance between understanding when to do the test and what you're going to do with that test. I would just reiterate that for contractors who are going to be coming, or vendors who are going to be coming into close contact for extended periods of time and remain so, then I think those individuals, the testing is really clear. For others, I think really stressing those other tools in the toolkit is going to be really, really critical, because it may or may not be possible to rely completely on testing for all situations.
Awesome. Thank you, Judd. Very, very helpful. Next question. Not to nitpick, but very curious about the actual Everlywell test kit turnaround time. You just mentioned 24 to 48 hour turnaround, but the Everlywell website says for secure digital results within 72 hours of the lab receiving your sample. That's probably best handled by you, Carlin.
All righty. So the way that Everlywell works is a little bit different than some of the other COVID-19 testing companies out there, and that is we work with a network of laboratories. We have 16 laboratories that we currently utilize to do COVID-19 testing. And what that does is allows us to control our capacity as well as our throughput. So if we have flare-ups in one area, we can send the kits to another area or another laboratory to be accessioned. And so what that does is a better opportunity to meet turnaround times, or we say 72, but generally we run between 24 and 48 hours. And we, in some cases, we come in much less than the 24-hour turnaround time. Time to turn around is when the sample comes to the laboratory.
Thank you, Carlin. Very helpful. Next one probably goes back to Judd. Any comments on environmental testing as a tool to guide human testing or other strategies?
Yeah, so a number of investigations into different strategies for environmental testing have been evaluated. So most commonly, people have been looking at either surface swabbing or looking in sewage as a means of detecting what infection prevalence might be. I would say that they're really promising, and those types of environmental sampling measures could play an important role. But I think to date, for the purposes of a workplace protection, I'm not aware of any really clear protocols or validated approaches that would be appropriate for the types of things that we're talking about here. Although I think stay tuned, that's probably an area for the future where we're going to see a lot more efforts.
Thank you, Judd. One more question. This still goes back to you, Judd. I noticed Thermo Fisher is only testing a portion of their workforce in the spot checks. How do I know what is the right percentage for those spot checks?
Yeah. So I think that's a really fundamental question, and it's really a factor of the baseline prevalence of infection in your population, the degree of change that you're trying to measure. So are you trying to see if it doubled or if it just went up by another percentage? What's that degree of change that you're looking for? And then your total population size. And those parameters, as well as some other parameters, can be used to put into mathematical models that will tell you exactly what that should look like and what that strategy can look like. Those types of supports can be provided by a whole range of different organizations. And I think Alan referred to some information that he can provide at the end of the call for some context on how to access that sort of support.
Thank you, Judd. Next question is, what is the cost of testing? I'll take that one at least as a start. Obviously, it varies. Maybe Carlin, you want to give some examples from an Everlywell perspective?
Sure. After the testing, we have transparency in our costs. So we have one cost for the whole solution, end to end. That includes the shipping, the kit, the laboratory, the physician oversight, as well as overnight to the laboratory. And we also include a dashboard that provides the employer insight and transparency into what's going on with their testing program. And that's all included in $109.
Thank you. So there's at least one data point. Next question, I think this is back to you, Judd. What do you think of UVC for disinfecting buildings? And maybe just speaking about disinfecting buildings in general.
Yeah, so protocols for disinfecting buildings usually include a number of components. So there's disinfecting, surfaces, which depending on the type of surface, the virus can remain active and viable for different durations. So from very short on surfaces such as cardboard to much longer on surfaces such as steel and glass. And then you, of course, got the aerosolized virus if people are talking or coughing in the environment. So different types of strategies are really important. There's no one size fits all that's going to clean all surfaces, all air, all the time, all together. So really it's about developing a protocol that includes appropriate, solutions for cleaning surfaces, appropriate solutions for ensuring very contaminated areas such as restrooms and water fountains, et cetera, get adequately cleaned, not just with the right solution, but the right frequency. And then obviously there are certain technologies out there to help ensure that any aerosolized virus is inactivated.
Thank you, Judd. Another one for you. Nice that we have the expert on hand. Your view on rapid testing.
I'm sorry, can you repeat the question, Kyle?
Yeah, sure. It's specifically asking for your view on rapid testing, Judd.
Yeah, there are a variety of different mechanisms for testing, and they all have different pros and cons. Rapid testing obviously offers, in some ways, the luxury of getting results back more readily, but many rapid tests are not as sensitive or don't pick up the virus as early as some of the other tests. So I think that the choice of testing modality is a pretty complex one, and I think it's really, it's very dependent on the situation in which you're going to use it and the frequency in which you're going to be doing it. So it's hard to give just a blanket sort of statement about what I think about any one particular testing modality.
Thank you. Certainly, it's in the news a lot today. Maybe another one for you, Carlin. It's my understanding that a test needs to be supervised by a healthcare provider. How is Everlywell able to accommodate this at-home testing requirement?
So Everlywell is partnered with a physician network. It's a national physician network called PWN. PWN provides the requisitions for laboratory based on the COVID survey that a patient takes when they register for the and then that works as well when there is a test. They will reach out and they will provide a telehealth consult to that person and let them know that they tested positive and what their next step should be. So we actually, the way our protocol and our platform is set up, you don't need to have an actual practitioner right on site. Perfect.
And then I had, I think, one last question at this point, and I know you spoke a little bit about this earlier, Alan, but how does infectious differ among asymptomatic, pre-symptomatic, and symptomatic individuals? I think maybe just some clarification on what you said earlier there would be helpful.
I'd be happy to. I think Judd is probably in a better position to answer that because it's really rich in academic findings, but I'm not sure there's a real answer yet. Judd, I'll pass it to you.
Yeah, I would agree with that. I think there's a lot we're still learning about this, but I think what we can say is that there's no question that any one individual can be more infectious even without having symptoms than other individuals who are symptomatic. So at the individual level, it's very difficult to see or make a clear statement about the degree of infectiousness as related to whether they have symptoms or not. And because we don't know if the individual that we're talking about in the workplace or in the environment you're talking about happens to have a very, very infectious scenario or not, we have to treat everybody as though they are really, really infectious. And the data right now, sort of looking at the association between symptoms and infectiousness, again, I think there's still a lot more we need to know. But again, just to reiterate, I think we cannot use symptoms as a clear marker of infectiousness.
Perfect. And with that, I think we'll wrap up today. First off, let me thank you, Dr. Walson, for joining us today. Much appreciated. Really appreciate your expertise. Alan, thank you for guiding that conversation. Carlin, thank you for being here to help answer some questions. And certainly to our audience, thank you for participating today. So with that, we'll wrap it up. Have a great day.